Hi, my name is Tanisha Jules Nobles, and I'm a psychiatric mental health nurse practitioner. October is Breast Cancer Awareness Month. Here are a few things you should know about breast health. One of the most important things you should know about breast health is how your breasts feel normally. This way, if you encounter anything that's different or abnormal, you can easily identify it. What actually happens in breast cancer is a normal, healthy cell inside of your breast tissue is damaged at its DNA. Once the DNA of a healthy cell is damaged, it then starts to mutate. It's the mutation that then causes the damage that we see as lumps and cysts and tumors. The National Breast Cancer Foundation has listed several risk factors involved in developing cancer of the breast. Now, this doesn't mean that you're going to develop breast cancer because you may have one of the risks. It just means that these risk factors have been scientifically connected or linked with the development of breast cancer. Some of the following are risk factors for development of breast cancer, including alcohol consumption, smoking and secondhand smoke, a family history of breast cancer, as well as trauma, loss, and unresolved stress that add a burden to your immune system. Also, oral contraceptive use for greater than 5 years. All of the above will place you at a greater risk. And again, doesn't mean that you're going to develop breast cancer. Those risk factors simply have a historic and scientific link to the development of breast cancer. In many cases, patients don't have those risk factors I mentioned. They don't drink alcohol, they don't smoke, they don't have a lot of unresolved trauma. However, they have contracted breast cancer in some way. And there are risk factors, as I mentioned, family history that you can't control. I believe more than anything, education, awareness, and the performance of self-breast exams are most effective in understanding what is normal, as I mentioned, and then also how to identify what is not normal. And when you find, or if you find a lump or a cyst or a nodule in your breast tissue, then what do you do? The self-breast exam is one of the most important things you can do, other than being educated and informed about breast cancer, how to prevent it, and what to do, is doing your self-breast exams every month. There are 3 key positions when you're doing it. One is, standing in front of the mirror, putting one hand behind your head, and then palpating, which is feeling with your fingertips, the pads of your fingertips around your breast tissue and your areola. Also lying flat on your back, again with your hand held behind your head, same feeling or palpation motion to assess the tissue for anything that may feel like a knot or glandular tissue, which is also very common, fibrous tissue. Another place you can do a self-breast exam is in the shower. So those 3 are very common and very easy to do once a month. Most people do it a few days after their menstrual cycle, if you're still in menstruation, if you're still experiencing menstruation. And then if you're postmenopausal, doing it at the same time each month. And if you're a male, I think that's another topic of conversation that is very necessary, because men do get breast cancer as well. So if you're postmenopausal, or for men, I would suggest doing the self-breast exam on the same day every month. Mammograms, yes. Women 40 years and older should get mammograms every 1 to 2 years. And if you have those increased risk factors, then perhaps having a conversation with your primary care provider is necessary, because maybe you need to have them more often. And even if you don't have any signs and symptoms of breast cancer, it's not a bad idea to get a mammogram, because those images see further than what a palpation or an inspection with our naked eyes can see. It can detect much more. So I highly recommend mammograms for women 40 and older. And if you have risk factors, again, even earlier than that is necessary. So in closing, I'd like to talk about a couple of myths that I've read and I've heard from patients about breast cancer. And I wrote them down because there's a lot. And I often like to address myths because a lot of people will pass along information that's not accurate. So regarding breast cancer, there are a couple of myths. Breast injury, or women with bigger breasts get breast cancer more often. That is a myth. That is not true. Only mid to older aged women and postmenopausal women get breast cancer. That is a myth. That is not true. Very young ladies and men both have been diagnosed with breast cancer. Breast pain is a sign of cancer. That is not true. As a matter of fact, a lot of women, a lot of people, because again, men get breast cancer, have felt something, and it wasn't painful, but it was something there. And it was breast cancer. So pain is not always an indicator of breast cancer. That is a myth. All breast cancers are alike, and they are terminal. That is not true. Breast cancers are different depending on the location, the size, and the stage, among other elements, as well as mortality. It doesn't mean you're going to die because you're diagnosed with breast cancer, especially at this point in technology and modern medicine. So that is not true. Finding a lump means you have breast cancer. That is not true. Some lumps, a lot of lumps, are benign. They are non-cancerous. Men do not get breast cancer. That is not true. My look is because I overstate that. I think men should do more self-breast exams because they do get cancer. Another one is self-breast exams are not helpful in finding breast cancer. Yes, they are. I think we went over that in the video. Yes, please do your self-breast exams. No one knows your body like you do. That is the most effective way to find it, is to touch, feel, know, experience what's healthy and what's usual, what's typical for you. And deodorant causes breast cancer. I have not read enough research, enough studies to say that that is a fact. So do some research. I highly encourage education. I am a student of health, and I love to read, I love to understand, and I love to share. So I hope that this has helped to enlighten some areas about breast cancer, and to have put it on your mind to prioritize your health and to do your self-breast exams and to do something nice for someone who has survived breast cancer this month and other months throughout the year, not only in October. Breast cancer is diagnosed every month of the year. So this month we celebrate those survivors and the families, but every month we should prioritize our health. Thanks for listening. I am honored to be able to share this information. Again, my name is Tanisha Jules Nobles of the PMHNP Master Class. You can find me on YouTube, Instagram, and Facebook. I post videos about mental health and wellness, and occasionally physical health because they're connected. So I look forward to engaging and sharing and also learning from you. Again, be well.